Hello dear viewers, in this video on ventilator graphics part 2, I am going to discuss scalar waveforms, where I will discuss different scalar waveforms and how it is useful in day-to-day management of critically ill patients. As we learned in my previous video that in scalar waveforms, one of the variable is plotted against time. There are three different variables which are plotted against time, and that is flow, pressure and volume. While time is always on the x-axis, another variable is on y-axis. It makes three different types of scalar waveforms: pressure time, volume time and flow time. This is volume time scalar. It illustrates the volume of gas administered to the patient's lung over time. It displays the volume of air during both the inspiratory and expiratory phases. The upward slope signifies the volume inhaled during inspiration, and the downward slope indicates the volume exhaled during expiration. Ideally, the inspiratory and expiratory volume displayed should be similar, suggesting a balanced respiratory cycle. However, a notable deviation, as you can see here, such as a sudden drop in volume, may indicate the presence of an air leak. This is flow time scalar. Inspiratory flow is depicted in the upper part of the graph with expiratory flow at the bottom. The inspiratory curve shape varies based on the ventilation mode. The first pattern displays a square waveform characteristic of a patient in a volume controlled ventilation mode, indicating a consistent flow throughout inspiration, as a tidal volume, inspiratory time and flow rate are all predefined. The second pattern shows a descending waveform typical of a patient in a pressure controlled mode, where the flow decreases as the lung pressure reaches the set target. Here you can see that the flow initially spikes to rapidly meet the pressure target, then tapers off, creating a descending pattern. Scalar B highlights flow waveform anomalies suggestive of airway obstruction. The expiratory curve portion is crucial for evaluating lung compliance and airway resistance. For instance, an obstruction might be inferred from a reduced peak expiratory flow and extended expiratory phase, evident from a prolonged time for the curve to return to baseline. Here you can see that the expiration did not return to baseline and new inspiration started, leading to air trapping. This is pressure time scalar. Pressure time scalar is a ventilator graphic that displays the variation in a patient's airway pressure over time during mechanical ventilation. The mode of ventilation influences the scalar shape. The first waveform represents a controlled mechanical breath on pressure controlled mode, indicating a uniform application of pressure throughout the inspiratory phase as the pressure is set to a predetermined level and it remains constant throughout the inspiratory phase, leading to a consistently square shaped waveform. The second waveform exemplifies a volume controlled breath in which a predetermined volume is delivered, causing the pressure to rise progressively until the set volume is achieved. This results in an ascending waveform where the slope indicates the increase in pressure required to deliver the preset volume. Scalar B offers a visual representation of plateau pressure, peak pressure, peak inspiratory pressure and the positive and expiratory pressure. Plateau pressure is measured during an inspiratory pause. This pressure observed in the absence of airflow reflects the amount of pressure needed to maintain lung inflation at the end of inspiration. Here I finish. Thanks for watching this video. In my next video, I will continue with ventilator graphics part 3. Till then, bye and take care.